Hi, welcome to my class on antiphospholipid antibody syndrome. I understand that a lot of you guys have newly been diagnosed with APS, so I just wanted to give you guys some information. My name's Alec, and I have a few other colleagues that will be able to help us throughout the day as well. So, antiphospholipid antibody syndrome, or APS, is an autoimmune disease that has two main parts. The first part is an antibody to proteins called phospholipid binding proteins. These are proteins that are normally found in your body. They can be found attached to certain cells or just going throughout your blood. The second part is an increase of thromboembolic events. That's a fancy way for saying things like blood clots, strokes, anything where a blood clot gets where it's not supposed to be. It can also have pregnancy manifestations. In pregnancy, often what will happen is a miscarriage, which is unfortunate, but it's a part of the disease process. It affects 17 to 50 patients out of every 100,000 patients. For every 9% of people that have a miscarriage, it's due to APS. For every 14% of people that have a stroke, it's due to APS. For every 11 people that have an MI, or heart attack, it's due to APS. And 10% of patients that have what's called a DVT, or deep vein thrombosis, have APS. Deep vein thrombosis is just a fancy way for what that medical people use to describe a blood clot in your extremities, like your arms or your legs, that can cause an obstruction. It can cause swelling, some discomfort. Half of all patients that have APS also have another autoimmune disease, like rheumatoid arthritis or lupus. In fact, 35% of patients that have APS also have lupus. As far as how we get APS, it's not truly known. It usually is a genetic factor, and we're not sure exactly what causes it. There's been some recent research into a two-hit system where you have a genetic predisposition and then something like an illness or a surgery that really gets it going. Some risk factors not to get the disease, but to increase the incidence of negative effects of the disease, such as stroke or MI, are cancer, smoking, use of birth control, obesity, high blood pressure, and high cholesterol. As for what you can expect to have if you have APS, there's a few clinical manifestations. The biggest one out of all of them is increased clotting. So these can be big clots in your deep veins, like deep vein thromboses, or they can be microclots that can go all over your body. In an extreme case of the microclotting factors, we can have something called catastrophic antiphospholipid antibody syndrome. This means that you have tiny clots, microclots, all over your body in major organs, causing multi-organ failure, such as liver, kidney, and heart failure all at the same time. This is the worst form of APS, and it affects only maybe 1% of people that have it. A few of the other things you can expect if you're diagnosed with APS is low platelets, increased incidence of miscarriage, having a stroke, especially in young patients, and a heart attack. Thank you so much. Now I'm going to pass you to my colleague to give you some more information.
Thank you, Alec. That was very informative. I'm going to go into a little bit of detail about common diagnostic tests for antiphospholipid antibody syndrome. So this is kind of a two-part process. This is a combination for clinical and laboratory criteria need to be met to be diagnosed with this syndrome. So let's first start off with the clinical criteria. So the first thing that we need is one or more vascular thrombosis, also known as a clot, in either the venous, arterial, or organ system that has been confirmed by imaging or positive pathology. So this can be things that include DVT. Brought a picture in today of a common DVT that you might see in an ultrasound. We can see in this ultrasound that the clot is obstructing the major vessel. The other part of this criteria, this clinical criteria, is pregnancy related. So a few things that pregnant individuals can look for is one or more explained fetal deaths within the first 10 weeks of gestation, one or more premature births of a normal healthy baby due to severe preeclampsia or placental insufficiency, and this usually happens within 34 weeks of gestation, or 3 or more spontaneous embryonic losses less than 10 weeks of gestation, and this will include any hormonal or chromosomal abnormalities. The next tests that we're looking at are all laboratory based. This is mainly going to start off with a venous blood draw. We're looking to see for abnormal antibodies in your bloodstream. The 3 main antibodies that we're looking for are lupus anticoagulant, abbreviated as LA, and this antibody affects the phosphate levels in your blood. So this will lead to an attack of the phosphate, leading to abnormal clotting. The second one is cardiolipo antibodies, and this one goes after the cardiolipins in the blood, which will also result in abnormal clotting. The last one we're looking for is beta-2 glycoprotein 1 antibodies. This antibody attacks the phospholipids found in your blood plasma, which again leads to abnormal clotting. Any variation of these 3 can be linked to a diagnosis of antiphospholipid syndrome. As always, if you do receive a positive test with any of this, it's important to discuss with your healthcare provider about other possible autoimmune diseases, as well as cancers or the possibility of HIV. Thank you.
Oh man, am I late? Oh well. Hi, my name's Daniel, and I'm going to teach you about the medications for antiphospholipid syndrome. I went ahead and wrote some notes because it's pretty hard to follow. Low-dose aspirin can be used for any patients that have APL antibodies, or specifically in pregnant women. For pregnant women, it is super important to start aspirin as soon as possible because it could reduce the effects of the syndrome on your pregnancy. Low-weight molecular heparins may be added, so you might actually have to take 2 medications, unfortunately, every day. But it just betters your chances of having a successful pregnancy. Warfarin is for patients who have already had a thrombotic event, which just means they had a blood clot before. Unfortunately, or obviously you don't want to have another one, so we use warfarin, which is a little bit stronger than aspirin, to reduce the amount or the chance of having a recurrent event. It works by reducing the actual parts of blood clotting, also known as the factors or components. And unfortunately, since patients that have already had a thrombotic event are at high risk of having another one and having detrimental effects from that, treatment will be lifelong. Anyone have any questions?
I have a question. I have to have surgery soon. Do you know anything about if I can take these medications while I'm having surgery?
Well, first of all, you should notify your physician that you have this disease and that you are taking medications for it. They'll likely tell you to stop taking your medication at least a week before your surgery, and you'll want to start your therapy, or you will be started on your therapy before you leave the hospital. Great question.
Thanks.
What about you?
Well, I have a question as well. I'm pretty fond of the drink. Any contradiction that about drinking?
Well, as fun as drinking is, unfortunately, mixing it with warfarin might be a dangerous idea. Any small cut or any fall that you might have may induce a lot of bleeding with that interaction, so I would recommend highly against it.
Thank you so much. So, as we've found out about antiphospholipid antibody syndrome, there is no cure. But there are changes in our lifestyle to help control this disorder and prevent complications. So you're going to want to talk to your doctor about those changes to your lifestyle, but one of them would be medication management. We want to reduce the chance of bleeding, since our blood is going to be thinner by both the aspirin and warfarin that's prescribed for us. We're also going to want to use soft bristle toothbrushes and wax floss, kind of like the ones I brought today, for each of you. We're going to want to reduce the chance of contact sports. We don't want We don't want to bleeding on the field, you know. Also, if you're a smoker, now would be a good time to quit. Smoking can increase the chance of blood clots, and since we're already at risk for blood clots, it wouldn't be a good idea. Behavior modifications, we're going to want to know about those so that we know when to go to the hospital. We want to, any unexpected bleeding, sudden changes in vision, sudden loss of movement to our limbs, or memory loss or confusion. We're going to want to go to the hospital immediately with those. Some signs and symptoms of PEs and DVTs. We're going to want our patients and ourselves to be aware of that just in case that's happening. To also go to the hospital. Medication management. Again, we want to take the medications as prescribed by the doctor. When he says what they say, those dosages are important. We're going to want to increase a healthy, balanced diet for ourselves. Green leafy vegetables. Minimize avocados, broccolis, Brussels sprouts, all the leafy greens that are too much in vitamin K. We're going to want to decrease our alcohol because of the chance for bleeding, the thinning of our blood, and of course, quit smoking. Thank you so much for taking part in our presentation today, and we hope that you've enjoyed it.